On the street, the Hudson police come face-to-face with drug addiction on a regular basis. In just the last 12 months, they've helped break up a drug ring and responded to dozens of individual overdoses. Like countless others, this department is wrestling daily with the balance of crime and punishment and treatment of a recognized mental health disorder. But as the epidemic continues to hit Hudson, another group is working in offices and at public events to tackle another side of drug addiction. Aware of the scale of the problem, public health leaders like Hudson's Kelli Call are launching new programs and building on old ones to prevent drug addictions before they start and treat those who do get addicted. We start with Kelli Call herself.
Across all communities, it's an epidemic. People are being touched left and right. Maybe not your family, but maybe a friend's family member or whoever. If you had about 100 people in a room, I'd guarantee like 25% of them have been touched by substance abuse or some form or another.
In response to that, the town recently joined a regional program aimed at distributing and training residents in the use of Narcan. Additionally, even before this program, the town had already stocked many of its municipal departments with Narcan. Now, the police, fire department, and public schools all stock it. Now, with this new program, the department has brought in 100 Narcan kits with a total of 200 doses of the drugs to distribute to local businesses and individuals for free. But even as Narcan proliferates, health officials are facing an uphill battle against stigma. That's not stigma against heroin, though, but indeed Narcan itself. Many say the drug enables addicts to overdose repeatedly. Calo, however, sees things differently.
The way we like to describe it is Narcan is essentially a fire extinguisher that's going to put out the fire. The fire is going to stop, but then you're going to need help after the fire. So people really need to be there to support these individuals in the community to be able to save them and then get them the help they need afterwards.
While not geared towards the growing community of overdose victims in town specifically, the health department's most recent substance abuse-related event was still a proactive one, approaching the problem not from an emergency angle, but from a preventative one. Earlier this month, the department partnered with local advocates to screen the short film If Only for Hudson High School students and their families. If Only, which portrays high school students struggling with substance abuse, has been widely used by activists as a warning in recent years.
For that event was, so for If Only, we wanted to kind of teach the kids that this is what's out there nowadays, and to let them know that there is support systems in place and that this can happen to them, this can happen to their friends, it can happen to a straight-A student, it can happen to anybody. So to really kind of put that seed in their back of their mind that this is real. And then for the parents is to create a conversation between the students and the parents to be able to have an open dialogue about substance abuse and to be able to have that conversation at home and be open and honest and for the parents to say, I support you, I'm here if you ever need anything. So hopefully we catch them before they ever get into that. But if they haven't, maybe they'll be able to open up.
Finally, the department has also responded to survey data recently collected and launched a program aimed at connecting at-risk teens with caring and trained adults to discuss their problems.
Students said that they didn't really have an adult that they could go to with these problems. So we created a Caring Adults Network that is essentially adults and teaching them how to create positive youth development in children and to be able to be there and say, listen, I know you're having a tough time. It's hard to be a kid these days. What can I do to help?
Crucial in all of this has been the work model led by the town's Substance Abuse Prevention Coalition. A group of individuals from a variety of town agencies, the coalition fosters collaboration between the health department, individual activists, the school district, and the police department, among other groups. In Hudson, in fact, many of those touched most closely by substance abuse disorders have turned their grief into activism and worked closely with Calo and her agency on many of these projects.
It's Kathy Leonard. She lost her son. He went to Hudson High School. We work really, really closely with them to be able to get out into the community and to share their stories. So Kathy was instrumental in getting the If Only event to the Hudson High School. We worked together to be able to get Jim Wahlberg out to get that on. Grades 8, 9, and 10 saw that, and then we did a parent show at the end. And she shared her story, which was so touching because she had pictures of her son walking through the high school.
Nationwide, drug overdoses are killing tens of thousands of people per year, earning attention from federal and state governments as well as the mass media. Locally, they're having much of the same effect. 6 Hudson residents fatally overdosed in 2015, 2 more died in 2016, and at least 1 died last year, although that number may rise once the state finalizes its data. For Kelli Call, challenging that means intervening early and helping those already hooked into the cycle of substance use break free. As she looked towards the future, though, she knows her agency's ability to continue fighting this epidemic may simply come down to its ability to keep funding itself and its events.
The current grant that we have is we just got the grant again for about 2 more years, and after those 2 years, it's renewable for about another 2 years. Since this is a really big public health issue right now, there is funding, fortunately, and I think that it's on the minds of every funding agency that they want to address substance abuse. So right now, we're not having too much of a problem with funding, but I'm afraid that once we start to see results, the funding will go down.